In this video, I'm going to share a trick with you where you will never forget about abdominal quad pain. During your Nclex exam, if they ask you question about a patient is complaining of pain in right lower quadrant or left upper quadrant, what is the pain associated with, right? So today I'm gonna share a trick with you where you will never ever forget about this trick. So let's say this is my right side, right upper quadrant, and this is my right lower quadrant, let's say, and this is my left upper quadrant, this is left lower quadrant. So 1 2 3 4, right? So the trick to remember this is you have to know this word gland, GLAND. I will explain you what is that meaning. GLAND, right? So let's say this is my right upper quadrant. GL, GL means gallbladder and liver pain here. If they give you question, a patient is complaining of right upper quadrant pain, that's means GL, gallbladder or liver pain. Now we move to right lower quadrant, right? So GLA, right lower quadrant means appendix pain. See, GLA, and then we A for appendix, right? And now we are moving to left upper quadrant. So GLA, instead of N, you have to remember these letters SSP, SSP, right? Instead of N, you switch it to SSP. SSP means stomach, spleen, and pancreas pain. Stomach, spleen, and pancreas pain. And left lower quadrant, that's remaining D, right? GLAND. D means diverticulosis pain. Diverticular, right? So see how easy it is. So you remember, right? GL, gallbladder, liver, A for appendix, SSP. So there is a trick. So you have to remember what is SSP. How can you remember? So you can remember SSP means student study plan, or those who are in India region, the SSP refer to police inspector, right? SSP. My uncle is SSP or my neighbor is SSP, right? So that way you will never forget now on, right? So again, right upper quadrant, GLA, you just have to replace N for SSP. GLA, SSP, D for diverticulosis, right? So now you know all 4 quadrant pain. So now let's practice 5 question, and you will see how easy it is for you to crack the answer immediately, right? So let's practice first question. Let me open it. So here is the first question. Pain in the right, so let's say you're taking your Nclex exam or your nursing school exam or HACI or any science test, you may get this kind of question. Pain in the right upper quadrant most likely involve which structure? So tell me, right upper quadrant, which structure is there? So GL, right? Gallbladder and liver there, right? So what would be your answer? Your answer is gonna be C. See, very simple, right? Liver and gallbladder. That's your answer number 1. Next question, a patient with left upper quadrant pain after trauma is most likely experiencing injury to which organ? So GLA, SSP, right? There is no N, SSP. What is there? SSP means spleen, stomach, and P for pancreas, right? So your answer is C, spleen. They will give you only one option. They will not give you all combined together. They will not confuse you, right? So as they are giving, either they're gonna give you spleen, they're gonna give you stomach, or they're gonna give you pancreas. So our answer is at this time spleen, right? See how easy it is now. Let's practice number 3. A patient present with severe right lower quadrant pain, right? Which structure lies in this region? So this is my right upper quadrant, right lower. So GLA, right? Gland, right? We are following gland. GLA, A for appendix. So is there any appendix there? Yes. Option D is your final answer, right? Appendix is there. Next question, a patient has tenderness across the left upper quadrant that radiate toward the back. Which organ is found here? So left upper quadrant, spleen, stomach, and pancreas, right? So is there anything there? So body of pancreas, see, the body of pancreas is there. So that is your answer, body of your pancreas. See how simple it is now. I hope you will never forget now. Pain at the right lower quadrant accompanied by nausea most likely involve which organ? So right lower quadrant, GLA, A for appendix, right? So answer D, cecum and appendix. So appendix is there. So that's the wrap up. Now you know all the abdominal quad region pain. So in during your Nclex or anywhere if you see this question, you can easily crack it. There are many more like gastritis or this or that, sigmoid colon or this, but the one I mentioned, 5 or 6, those are the main that they might ask you during your Nclex exam. Appendix, what you call, diverticulosis, something like that, right? Diverticula, spleen, gallbladder, appendix, those are the main ones. So I hope after watching this, you will never ever forget it and you will share with many people of your co-worker, friends, nursing student, here, there, right? Right.